Okay, Anissa, so we'll get everybody caught up. End of week 1.
Yes. So far, had a lot of other symptoms. My arm, though, has been holding pretty steady. 0 to 2, mainly pain levels when I'm having pain with it.
Where is your arm normally out of 10?
It will get down into 0. It doesn't stay there very long usually. So most of the time when it's aggravated, it'll go up to like a 4.
Okay, so just to be clear, because we talked about this today, you
Yes.
had treatment before.
Yes.
Starting October of 11, correct?
Yes.
Okay, and you were here through December, and then you came back 2 short periods of time after that.
Yes.
Like a few visits each. How bad was your arm before that?
My arm was so bad that I was leaving the pain management doctors in tears because it was spreading into my shoulder, and I was about to have to go out of work because I couldn't do my job as a nurse, and I was in so much pain most of the time that as much as a light breeze would turn my whole arm purple and mottly, and I couldn't stand it. And I just would force myself to do things that I really probably shouldn't have been doing because I had to.
Because you're a pediatric nurse?
NICU, yes.
All right, and it's not in the other shoulder anymore, is it?
No.
Okay.
No.
How did that treatment hold after your treatment here in 11, beginning 2012?
I went from consistent, always having pain of probably a 3 or 4, even when nothing else was going on, to sometimes having 0. My normal now runs about 0 to 2, and even when I get the spikes, it doesn't last as long and it's not as high. Like, my pain would be off the charts if somebody so much as bumped me. Now, there's times if I get bumped hard enough, it'll go up to an 8 or a 9, but it usually calms down within a good half an hour, sometimes before it would last for days.
Okay, and you're back here because you had a lot of stress in your life, and we started with the knee.
Yes.
Okay, and you're still sitting kind of, I'm just going to show our audience.
Yeah.
You sit like this a lot.
Yes.
Okay, how did your knee do this week?
It's kind of been up and down, but once I get the treatment, it does last for a few minutes, probably a good 10 to 15 minutes before it starts getting aggravated again, which from what I recall was pretty normal with what my arm would do too. And sometimes it'll get really angry after a treatment, but that was kind of the way it went last time too, before it started really getting itself together.
Okay, and I've had lots of questions about how the treatment works, so I'm going to do a short video on Monday where I'll just talk about that. Right now we're just going to record your progress. Everybody in Austin wants to know how you're doing, so we'll catch up with... by the way, you slept how many hours last night?
Oh my goodness, I slept for uninterrupted 11 and a half hours last night without any melatonin, any pain meds, nothing. All just on my own.
That's a good sign. And how long do you normally sleep on your own?
Well, I work nights, so sometimes I'll sleep for 20 hours if I've worked 3 nights in a row, but usually if I've been off like that, I don't sleep that well, maybe like 8 hours.
Okay.
But I usually take melatonin to go to sleep, so it's nice to not have to take anything.
Okay, so we will go finish your treatment for today, and we'll be back on Monday.